Hi everyone, today we would like to present about atherosclerosis.
I'm going to give a short introduction about atherosclerosis. Atherosclerosis is a long-term disease where lipids, inflammatory cells, and fibrous tissue build up inside medium and large arteries. These arteries form plaque that make the vessels narrow and stiff. This is important because it's one of the main causes of heart stroke and strokes. There are really no symptoms, but if a plaque suddenly breaks, it can lead to a very serious and life-dangerous events. Atherosclerosis is linked to many risk factors, such as high blood pressure and high LDL cholesterol diabetes, and smoking aging. Some studies also show that genes like BTK and ITGAL and more may affect how macrophages change and how foam cells form, making plaque grow faster. When the disease becomes serious, some symptoms like joint pain and arm pain during work may appear.
Okay, now let's look at the current situation of atherosclerosis. Atherosclerosis is still one of the biggest health problems worldwide. According to the Global Burden of Cardiovascular Disease report in 2023, it caused over 19 million deaths. So what makes it worse is that about 80% of these cases are linked to lifestyle factors like high blood pressure, high cholesterol, unhealthy diet, obesity, and high blood sugar. So there is also a lot of silent atherosclerosis happen. A review of 92 studies found that 23% of healthy adults already had plaque in their arteries. So that is basically more than 1.1 billion people who may have early atherosclerosis without symptoms. So now look at what happened in Malaysia. According to the Department of Statistics Malaysia, ischemic heart disease caused over 20,300 deaths in 2022, making it a major cause of death in Malaysia. So a national study using the Framingham risk score also showed that many Malaysians aged 30 and above already have a high 10-year risk of developing heart disease. So overall, this number shows that atherosclerosis is increasing and it is happening earlier, and Malaysia really needs strong early prevention and public health effort. Next, we proceed to the pathophysiology. So, before we go into the stages of atherosclerosis, let's look at how blood flow behaves inside the artery. So, as you can see in this both figure, when the artery is straight, the blood moves smoothly. So, this is called laminar flow, and it creates moderate shear stress that keeps the endothelial cells healthy. So, but at the branch point or curve, the flow becomes disturbed or turbulent. So in these areas, the shear stress becomes low and irregular. So this kind of flow weakens the endothelial cells, which makes them round and more prone to injury. So because of this weakness, substances like LDL cholesterol can easily enter the vessel wall and start building up. So atherosclerosis usually begins at these disturbed flow areas like bifurcations and curved regions. So this is where the artery is naturally more exposed to damage. We proceed to the stages of atherosclerosis and see how it happens in the artery. Atherosclerosis starts when the inner lining of the artery, which is endothelium, gets damaged. So once this layer is injured, the LDL cholesterol and other substances begin to build up in that damaged area. The LDL cholesterol that enters the wall becomes oxidized, and this oxidation acts like a danger signal. The damaged endothelial cells then release the chemical signals to call for help. Then monocytes in the bloodstream will respond to the signal and move to the injured area, and then will change into the macrophages, which are the immune cells that try to clean up the oxidized cholesterol. Second stage is fatty streak formation. So these macrophages will try to clean up the oxidized cholesterol by engulfing it. But when they take it too much, they turn into a foam cell. These foam cells will start to build up and form a fatty layer called a plaque. So as the plaque grows, the artery wall becomes thicker and harder. Third stage is fibrous plaque formation. To stabilize the plaque, the smooth muscle cells from the artery wall will multiply and move toward the surface of the plaque. So this will help form a fibrous cap that recovers the plaque. But as the plaque gets bigger, it narrows the blood vessel. Last stage is plaque rupture. Over time, the fibrous cap can be unstable and eventually broken down. So when this happens, the contents of the plaque will spill into the bloodstream. So this will trigger the blood clot formation called a thrombus. So this clot can block the artery and reduce or maybe completely cut off the blood supply to the body, which will cause a serious issue like a heart attack or stroke.
Next, treatments and potential complication.
The foundation of treatment is lifestyle modification. This includes regular exercise such as walking or running on treadmill, cycling, and exercise for at least 30 minutes a day, and adopting a healthy diet that is low in saturated fats, salt, and processed food. However, a key complication with lifestyle modification is poor patient adherence. Many patients struggle to maintain long-term changes in diet and exercise habit because it requires continuous discipline and motivation. Next, the treatment is pharmacological therapy. Statin is a drug that would inhibit the enzyme HMG-CoA reductase. Normally, this enzyme will help produce LDL cholesterol, which contribute to plaque formation. However, when statin inhibit this enzyme, LDL production will decrease and will reduce the atherosclerosis progression. But statin have a potential complication called rhabdomyolysis, which is a serious condition involving muscle breakdown. Aspirin would inhibit the COX-1 enzyme, which reduces the production of thromboxane A2 that normally promotes platelet aggregation and vasoconstriction. So aspirin help prevent the formation of fibrin-rich blood clots and help keep the blood vessel open. However, long-term aspirin use carries the risk of gastrointestinal bleeding and intracranial hemorrhage, especially in high doses or in elderly patients. Next is interventional and surgical procedure. Coronary artery bypass grafting, also known as CABG. In CABG, a vessel is taken from the leg or arm and used to create a bypass around the blocked coronary artery. This open heart surgery can be done on pump using a heart-lung machine or off pump where the heart continues beating during the procedure. The surgeon may perform 1, 2, 3 or more bypass grafts depending on how many arteries are blocked. Complications of CABG including post-operative stroke and sternal wound infection. Last, percutaneous coronary intervention or PCI. This involves angioplasty and stent placement. A catheter is inserted usually through the radial artery and guided to the blocked coronary artery using fluoroscopy. Once the atherosclerotic plaque is reached, a balloon is inflated to widen the vessel and a stent is placed to keep it open. Possible complications of PCI include stent thrombosis, which occurs when a clot forms on the stent, and restenosis, which is the gradual narrowing of the vessel again due to excessive tissue growth. In conclusion, atherosclerosis is a major health problem that developed silently over many years before causing serious issues like heart attacks and strokes. From the statistic, we can see that the number of the cases continues to rise worldwide, and in Malaysia, many youngest adults are now affected, showing how early the diseases can start. The pathophysiology shows that atherosclerosis starts with endothelial dysfunction, followed by LDL accumulation, inflammation, plaque formation, and also in severe cases, plaque rupture leading to thrombosis. This progression explains why early prevention is so important. Lifestyle changes such as healthy eating, regular exercise, and quitting smoking are one of the steps of early prevention. Treatment like pharmacological therapy such as statin and aspirin will help to reduce cholesterol and prevent clot formation. In more advanced cases, procedures like PCI and CABG are needed to restore blood flow. However, each treatment comes with potential complications, so choosing the right option must be suitable to each patient. Overall, effective management of atherosclerosis requires early prevention, good control of risk factor, and personalized treatment strategies. With better awareness and consistent monitoring, the burden of this disease can be significantly reduced.